Hi, will your hospice election statement and certificate of terminal illness pass the test? I'm Cindy Hatton with Hospice of the East Bay and the chair of the CASA Hospice Committee. Recently, the OIG came out with a report that indicates that we have some deficiencies in both of these areas. So it behooves all of us to pull them out and review them to make sure that they meet all the criteria. Your election statement. It should have the name of your hospice. It should have a statement that indicates that the patient understands that hospice is palliative and not curative. It also needs to state that certain Medicare services will be waived under the hospice benefit and what those services are. Also, it needs to indicate who the patient has chosen for their attending physician, and it can be a physician or a nurse practitioner, and that they made that decision by themselves. The nurse practitioner and the physician, you need to have their name, their office address, and their NPI number so that there isn't confusion who that is, because there's many physicians with similar names. Also, it needs to be signed and dated, and the election date needs to be, it can be that day or it can be a day in the future, but it cannot be retroactive. Now on to the physician narrative. This is where the physician documents why that patient meets the criteria. It is their clinical findings that meet those criteria. So it's a development of the trajectory of the illness. It's a sequencing with facts and medical data in it. It is based on the medical judgment of that physician. It also is supported by the assessments from the team at their comprehensive assessment. It needs to have no check boxes. It needs to have no bullets. It should be a sentence or a paragraph. It needs to have an attestation statement that says that the doctor, that he or she composed the narrative based on a review of the medical records or an examination of the patient. It has to be signed and dated, and the signature has to be at the very bottom. There can be no narrative or no statements after that signature and date. It needs to have the benefit period and the dates of that benefit period. It also needs to have 10 other elements. It needs to have the hospice diagnosis, the age, complicating medical conditions that are impacting that prognosis, functional assessment. You need to look at the ADLs. You can use the PPS scale. You'd also need to have nutritional impairments. You've got weight, BMI, arm circumference. You've got cognitive impairments. You need to use the FAST scale for dementia patients. You need disease-specific symptoms such as dyspnea at rest, aspiration, angina. You need physical findings, what the burden of the disease has been, when was the onset, what the treatments are, how fragile the patient is the patient sleeping 12 hours or more, and then also finally an individual statement that says, it is my professional judgment that this patient has a 6-month prognosis. If you need more information, look at your Medicare Benefit Policy Manual, Chapter 9.